Hey guys, it's Christina. So today I wanted to talk a little bit about water. It is very important to the human body that we have water because without it, we could not survive. I think a lot of people don't drink as much water as they should. I am definitely guilty of that for a number of reasons. First of all, it's flavorless, I suppose, so it's really not that exciting. I don't like drinking tap water because for whatever reason, since I moved from Colorado to South Dakota, I can taste the quality difference and it's terrible. Also, I like my water really cold, and I've also noticed that if I'm drinking water from a bottle, it goes down a lot quicker for me than if I drink it from a cup. So, just a couple personal things that I've noticed about myself and my lack of consumption of water. But, having diabetes and having to manage my insulin, water is very important, and I don't think enough people realize how important water actually is. So, I've composited a little list to kind of go over just to kind of give you, kind of hints if you're not getting enough water. So that way that is something you can maintain. Because if if you're not drinking enough water, it affects all of your organs, especially your kidneys and your liver, because then it prevents them from actually being able to process out all the crap that we put into our bodies. So, with that said, I guess, the few things that I've done my research on as far as to being able to tell if you are actually drinking enough water, I guess here's the list. Number one is pay attention to how many times you are going pee a day. The average person who is drinking enough water, they'll usually pee between 6 and 7 times a day. If you're only peeing about 2 to 3 times a day, you're definitely going to want to increase. Because, like I said, it does affect your kidneys and your liver quite a lot when you're not actually consuming enough water. If you're not drinking enough water, you can also get a lot of headaches. It does, a headache is actually the increase or decrease in blood flow in your body. When you're not drinking a lot of water, it decreases your blood flow, which obviously causes headaches. Another thing to kind of keep a watch on is your skin and your lips. If you have dry, chapped lips, I know in the wintertime, dry, chapped lips, it's going to happen. It's dry and cold outside. But, if they're cracking all the time, frequently, and your hands are really dry and cracked, that is a big red flag that you are not drinking enough water. I use chapstick. I don't really know a lot of people that don't use chapstick, but even if, when I'm not drinking enough water and I am using chapstick, my lips are super cracked, super dry, and they just don't seem to heal. So just increasing your water will definitely help that. Also, I don't like to say this, but rhinoceros skin, if you have really dry, thick patches of skin, that is a very big, clear sign that, you're not drinking enough water. Your hand should be smooth. You should be able to see your hand lines, but they shouldn't be jumping out at you. Excuse me. Another thing, to kind of keep out for or keep an eye on is, if you have dry mouth. I know a lot of people have dry mouth for certain reasons. However, if you have dry mouth all the time, it is kind of a sign that you're not drinking enough water as well. When you drink water, it stimulates the mucous membranes, not only in your mouth and your tongue, but also your throat. So that way, your mouth is properly lubricated, as much as I hate that word. Another thing is, to pay attention to is the color of your pee when you go pee. It should be, lightly yellow. If you're drinking a lot of water, obviously there's not going to be much color to your pee at all. If you're not drinking enough, it's going to be dark. It's going to smell. And when it starts to smell, that means that you are definitely not getting enough water, and that your kidneys are not processing what you're putting into your body as effectively, because that smell is the bacteria. That is, and the stronger it gets, obviously, there's more bacteria. Another thing is being hungry. If you're really hungry all the time and, you've just eaten and you're constantly craving snacks, even though, you've just eaten a meal, that is also a sign that you might not be getting enough water. If you're full, that's one thing, but if your body is not full on water, it's going to keep thinking that it's hungry, because it is trying to, supplement that. It's trying to get that from your body, and if you're not giving it to it, obviously it's going to keep looking. If you're dizzy, if you get dizzy on a regular basis, like in the summertime, I've noticed when you're not drinking enough water, you're out there playing, doing whatever, you do get dizzy. And it's because of the heat, but it's also because you aren't giving your body the water that it needs to keep itself cooled down, which, it deprives oxygen to everywhere in your body, again, causing those headaches and dizziness. There are some cases where you could possibly pass out by not having enough water. Dehydration, that is a thing, especially in the summertime. Excuse me. When it's really hot, that is very important to make sure your body is properly hydrated, is able to cool itself properly. So that way, you can continue to do your regular everyday things without actually being affected. Some symptoms of chronic dehydration, some people have reached the point where they've gone past just not having enough water and their body is dehydrated and they're unaware of it. Urinary tract infections are very common when you don't get enough water. It does age your body very quickly when your body is deprived of that water, because it's taking the moisture and the water from your skin and other organs, and it's trying to filter it through your body. So you can age very quickly if you're not properly hydrating yourself. It does cause a lot of chemical imbalances in the brain when you are not drinking enough water, which can cause anger, confusion, anxiety, pre-dementia. It can also, there's not a lot of studies on it, but it can, possibly, increase the risk of Alzheimer's, I guess is the best way to put it. There's not a lot of factual stuff on that, but, seeing as how Alzheimer's really wasn't a thing a few hundred years ago, and just, the modern consumption of food and beverage in general, Alzheimer's is on the rise. So, I think that is at least a viable possibility that can be, a pretty high cause for that. High cholesterol. If you're not giving your body enough water and you are eating a lot of crappy processed foods, the sugar and the fats and calories, saturated fats are going to go up in your body, which is going to cause high cholesterol. If you're not consuming water enough, it's not able to break that down in order to process it and, go from there. Constipation and heartburn. Obviously drinking enough water, you're going to get constipated. That's just what it is, especially if you're eating a lot of dairy, you're going to get constipated. So water is really, the number one thing to break that down and allow you to move freely. Everybody poops. Sorry if you're offended. Everybody poops. I pooped twice today already. That's just something that the body needs to do. And, people who don't like talking about poop, well, I guess you don't poop then, but that's what it is. It can definitely cause constipation if you're not drinking enough water. That's why if you have any major surgeries or whatever, they're usually putting you on some sort of narcotic for pain. And after I had my gallbladder out, actually, they had me on a couple pain pills, and I thought I was drinking plenty of water, but I wasn't. And within a couple of days after my surgery, I was having the most unbelievable pain in my gut. I could barely move, sitting up, standing up, laying down. It was just completely painful. So, I had gone to the doctor. They had done, an x-ray of all that stuff. And the bowel in my colon was literally, it looked like ribbon candy all the way up. It was up to my lungs. And that's why it was so uncomfortable. And at that point, they had to give me, I can't remember what they gave me. It was some red, disgusting tasting drink. But they gave it to me, and obviously that cleared everything up. But if I would have consumed a little more water, it is a very good chance that I would not have had quite an issue with that. The heartburn, a lot of the acids in our stomach, when we are digesting, they, acid reflux, it comes back up. That water actually suppresses it down if you have enough water in your body when you're eating. And, with those additional acids that are going, they can, dilute themselves so that way they're not as bad. I'm not saying it's going to, stop your heartburn completely. You may have to get some sort of Tums or, whatever you've talked with your doctor to try to reduce that. But drinking a lot of water will definitely help. Also, with the heartburn, if you drink a full glass of water with your meal, every meal, that does help a lot also because, again, your body is able to mix with that to dilute all those acids down. So not only can you process your food better, you don't have that acid indigestion, and, overall you feel better. So, I'm sure people have probably touched on this topic a million times, but, changing my diet and the way I think about things in general. I just wanted to point that out to a couple other people. You're not alone in whatever journey you are on right now. You're not alone, and knowing more people and getting yourself out there, talking to more people, it's going to allow you to become more educated, more self-conscious, more self-aware, and, just in general, happier. If you're able to get more information and process it, however you process your stuff, the more research you have, the better you are. A lot of researchers, they never look just in one book. A researcher would lose their job if they just read one book and were done with it. They don't even read a full book. They pick out pieces, that is relevant to whatever they're looking at, and then they go to another source. So, I definitely encourage that to everybody who is watching or subscribing, if you would like to subscribe. But, just be self-aware. And, I'm definitely not saying that anything in my videos is right or wrong. I am simply giving you my opinion and how I've incorporated that into my everyday life. And I'm just trying to give people, ideas and thoughts. And, I appreciate those back. If you have a topic that you'd like me to go over, if you have questions for me, if there's something that I've said that you don't like, or, just whatever, I'm open to everything. This is definitely an adventure. It's a learning curve. And it's a journey, not only knowing my personal opinion and those close to me, but also from people that I don't know, and, just see what works for everybody, what works. And obviously the same thing is not going to work for everybody, but that's another thing too about incorporating yourself into a community, is that what works for you might work for this person over here, may not work for this person over here, but the ones that you have the commonality in, you can actually kind of work for that and better yourself. So anyway, that's all I wanted today. I know I ramble and I kind of get off topic a lot, but that's just who I am. And I just wanted to share my thought and, see what you guys have. So anyway, thanks for watching. Again, definitely subscribe if it's something that you would like, and hopefully I'll have up some more videos soon. Thanks so much.